Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 6 surprising causes and risk factors for cervical radiculopathy, and you actually will not believe number 4. So the first cause and risk factors is actually degenerative disc disease. As you see here, this is a normal disc. So we have the spine, and we have the spinal cord here, and you have your spinal nerve, and that's usually where you have compression for cervical radiculopathy. So this is the upward view from the top. So this is a skull here, and this where you have your cervical nerve actually coming down the nerve root and going to the nerve going to your upper extremity. So this image in the screen is actually a top view here. You have the vertebrae and you have the disc in between the vertebrae. So when you have degenerative disc disease, usually there is a degeneration in the outer layers of the disc here that compressing on the nerve. So one of the risk factors is degenerative disc disease, and that actually could lead to the second cause is herniated disc, which actually the bulging of the disc here and compressing on the nerve. The third cause and risk factor is whiplash, and that's usually happen from car accidents or any sports injury or trauma that cause hit in the head, that causes sprain and strain in the cervical spine and cause compression on the nerve from inflammation or other tissue damage that compress on. The fourth cause that actually overlook, and actually you can address it now to decrease your risk of cervical radiculopathy, is poor posture. So when you have a poor posture for a very long time, like slouching forward, looking down in the front of your phone or a book, or poor posture for a very long time, it's actually cause degeneration in the joint and cause cervical radiculopathy. So the other cause and risk factor, the fifth one is poor posture, body mechanics, or poor lifting mechanism. So when you do incorrect way of lifting and heavy lifting with the jerky movement, that could compress on the nerve and causing compression and degeneration that could cause cervical radiculopathy. So improper lifting, body mechanic is a risk factor. The sixth cause and reason is osteoarthritis or rheumatoid arthritis. As you see in this image here, normal joint should look like nice and smooth like this. When you have arthritic changes, you start to have uneven surfaces in the joint, and that uneven surfaces, if it's compressing on the nerve here in the cervical spine, it's gonna cause cervical radiculopathy. So degeneration in the joint itself or related to disease like osteoarthritis or rheumatoid arthritis could cause the cervical radiculopathy. And I will leave a link underneath this video for how to fix cervical radiculopathy, the 3 most effective powerful treatment that you have never heard of to treat the root cause of cervical radiculopathy. If you have any question or comment, leave it in the comment section below and I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.